It's been more than 4 years since Christy Harnett took her own life. Time hasn't lessened the pain.
She was the light of every party. She was singing, dancing, would help anybody.
Just 17 years old when she died, Christy was under the care of West Lane Hospital in Teesside, run by the mental health trust Tees, Esk and Ware Valleys. The unit was closed following her death and the death of one other. But the story that has not been told is what happened to the other patients who were there, what's happened to the families left behind.
When I was on observations, they used to sit outside my room. I'd have a piece of glass and I'd just be slicing my wrists while they were watching.
Really, the first thing that comes to my mind when I think of that hospital is emotional pain, is trauma, is not being safe.
Christy's family showed us a text message in which she says, "I'm going to end up dead if I'm honest. They sent me back to Newbury. That's a ward at West Lane, where she took her life 3 weeks later."
Sitting in Christy's room on a visit, you could hear a patient in the room next door banging their heads on the walls. And I went out to see if I could find a member of staff, and they were stood just down from Christy's room and they were talking to each other and they just said, "It's okay, she'll stop soon." And that was just the attitude.
Christy's stepfather told us that she only ever self-harmed to stop the voices in her head.
She always said that she never wanted to die, but for that brief moment when she either passed out or was near that phase, the voices stopped, and that's why she did it. And if you look back, she only ever did it when she was on observations, when she knew she'd be found. And when she went back, they'd changed the observations to every 20 minutes, and she didn't know. She would have been thinking that someone will come and find me, but unfortunately no one ever did.
In March this year, a final report was published into the deaths of Christy and another teenager, Nadia Sharif, at West Lane, and into a third, Emily Moore, who had been treated there but died at another of the Trust's hospitals. It found insufficient staffing, low staff morale, ineffective management of change, lack of leadership, aggressive handling of disciplinary problems, and failures to respond to concerns from patients and staff alike. Following one incident, 33 members of staff were removed from duty after a complaint of inappropriate restraint. The Care Quality Commission is now prosecuting the Trust, which has pleaded guilty following the deaths of Christy and another patient known only as X, but not guilty in Emily Moore's case. No prosecution was brought over Nadia. One ward has now reopened with the care provided by another mental health trust, leaving some children having to go out of area. The problem for the former patients who were in here and their families, and it's the same in many of the NHS scandals across England, is that you very rarely hear from those people at the top. The board of governors, the trustees, the chief executive and the management teams, they move on, they retire or they go to other jobs, while those patients, those families are stuck wanting answers.
We're a caring society, but we're not. Not when it's inconvenient.
And figures show that as many as 279 children were in the unit between 2016 and 2019.
Nobody, and by that I mean Tees, Esk, Ware Valley, the NHS England, the clinical commissioning groups, has cared enough for those children and for those families that are looking after those children to say, we need to see if they need help, because we're aware of the awful conditions that were operating at West Lane for so long. It was a catastrophic hospital, and it ended catastrophically for those children.
Oliver Neat was in the unit with an eating disorder and left when it was closed.
I remember CQC visiting, and parents were asked what they thought about the hospital, and I said to CQC, "It's so terrible," and I told them some things had happened. "A child is going to die here, it might be my child." And then a week later, after I'd said that, Christy did actually die.
In the months after the unit closed, Oliver struggled to get help. When you couldn't get the help, what happened?
I jumped off a 4-storey roof.
Because you were so desperate?
Yeah, because I didn't want to eat anymore. Because I didn't want to keep living.
What needs to be done?
Somebody needs to say, we're going to get a hold of all those families, not the children themselves, because I know of children who, if you mention West Lane, will go into a complete meltdown. You need to get in touch with their families and say, how are things? What can we do?
Angelica Donnelly was in West Lane for 18 months. She told us she had never cut herself until she went into the unit.
I get haunted every night with nightmares, with night terrors about things that happened in that hospital. I went into that hospital with not one scar on my body. I've came out of that hospital with scars all over my body now. That'll never go away. And, you know, in terms of things like ligature risks, things like that, there'd be times where staff would come in and they'd shout, oh, it's not tight enough yet, and then they'd go.
Were you ever approached by the Trust saying, we understand you must have gone through some pretty traumatic times there. Do you need any help?
No, I've never received anything like that from the Trust. I believe that the Trust should do something like that, reaching out to patients in order to accept responsibility, because I still don't believe that they have. I don't believe they ever will.
The Trust said,
we've been consistently clear that there were unacceptable failings in the care and treatment provided to young people at West Lane Hospital in 2018 through to 2019. We reiterate our heartfelt and profuse apologies to the families and friends of Christy, Nadia and Emily, and to all others impacted by their care at West Lane. They deserved better, and the new leadership team remains firmly of this view.
The families are calling for a public inquiry so their voices can be heard, and so those who were in charge or on the Trust board at the time would have to give evidence.
The previous CEO, he resigned. And obviously in the investigations that have been, he's never been spoken to because he doesn't have to. Whereas in a public inquiry, he'll have to, and then he'll have to explain why he wasn't, you know, making sure it was run properly.
This is all they have left. But if Christy's voice is now silent, her family can still speak, and they will, in her memory.
Victoria Macdonald reporting. Well, earlier I spoke to the health policy analyst Roy Lilly, who's a former vice chair of West Surrey and North East Hampshire Health Authority. And I began by asking him what actions need to be taken to protect vulnerable young people.
It's horrendous, isn't it? And time again, we see this. I just think the NHS England needs to take mental health services seriously. It was 12 years ago that they said they were going to have what's called parity of esteem. That means they're going to take mental health as seriously as they take physical health. Just to give you a flavour of that, there's been a 6% growth in 10 years of psychiatrists working in the NHS. In the physical health department, if I can put it like that, it's been an 86% increase in growth.
Is this a funding issue then, or is there something more fundamental here when you talk about parity of care between the two, between physical and mental?
I think, look, in fairness to the government, there is more money going into mental health. I mean, they always say that, and it's true. But the difficulty is it's the amount of people that we've got who are going into mental health, to work into mental health. I mean, the staff vacancy rates are now up at about 20%. And, you know, no trust can manage that. So it's partly about money, but it's partly about recruiting people and training them and keeping them. We lose a lot of people with mental health experience because it is such a difficult sector to work in. People get exhausted, they get burned out, and they say, I just can't do this anymore. The whole of this service is the Cinderella service of the NHS.
We heard in Victoria's report there that families really want some sort of accountability and a public inquiry. How could that help?
Well, look, I mean, I'm not a big fan of public inquiries. They take forever to organise and they take forever to report. Certainly do think some kind of a national audit or some kind of inquiry, not necessarily a public inquiry, to look into mental health services to find out why they are so poor. And it just seems to me that we've kind of plodded along with mental health. We've added layer upon layer of regulation and a bit more money and a promise to recruit more people. But it's just like one big layer cake. I mean, the whole thing really needs to be dug up and looked at afresh. It needs much more of a community focus, particularly with young people. I think hospitalizing people with young people with mental health difficulties should really be the absolute last straw.
One of the family's issues and what they wanted to look into was accountability. Their concern is the people that were at the top of the trust have been moved aside and not necessarily held accountable. What one tangible thing should be done to help these families and to support these families right now who are going through it?
They need a much bigger focus and much more support than they're getting now. They're just, when bad things happen, families are just left to get on with it. And in the same way that the police service has family liaison officers, I think the NHS should have family liaison officers to see families through these difficult times.
We see managers in the NHS get moved aside sometimes and not necessarily held accountable. What should happen then?
There should be much greater accountability. I mean, often managers know when a bad report is coming, it's time to duck out and find another job. There's been a lot of talk recently amongst the public and MPs about whether or not managers should be regulated. We've seen this in maternity services as well, and the Letby inquiry talks about the regulation of managers. I'm not a great fan of regulation. I think another layer of regulation is something the NHS can do without. But I think I would put much greater emphasis on HR practices to figure out why people left their previous trust, have a proper look at their references and make proper inquiries as to their behaviour in their previous job.
Roy Lilly, thank you very much. Thank you for your time. And if you've been affected by any of the issues raised in that report, you can find a range of places to seek help on channel4.com/support.